So, good afternoon to everybody. Hello, how are you? Fine? Keeping good health? Yes, and you must. Okay, now coming to say our today's topic. If you remember that in last lecture we were discussing about that is the regulation of blood pressure. Before that, I would like to remind you some of the things which we have seen. That is, once again, definition part, physiological factors affecting blood pressure, then methods how to record the blood pressure. This you will study in detail when we will conduct practical and the cardiovascular system. The most important part which we were discussing was what are the mechanisms or which are the mechanisms which regulate blood pressure. And we have seen there are say local mechanism and the other mechanism, say what we call it as say that is the chemical or neural mechanism. In say local mechanism, we have seen autoregulation, the role of some of the vasodilator substances which is secreted by the blood vessels and the body. Similarly, we have seen that is two important theories, say that is the myogenic theory and the metabolic theory. Then now coming to the other type of say that is the mechanism or the other group of the mechanism, that what we call it as a mechanism for, that is we may say broadly it is say that is involves that is the chemical or that is a neural mechanism. But however, in this traditionally we used to teach this regulatory mechanism under say three different classes. There are three categories or three mechanisms for blood pressure regulation. They are mainly divided into rapidly or short acting mechanism, second intermediate acting mechanism, and long-term acting mechanism. Depending upon the time duration which is taken by this regulatory mechanism to regulate say this blood pressure, hence they are say divided into three categories: rapidly or short acting mechanism, intermediate acting mechanism, long-term acting mechanism. And rapidly short acting mechanism, there are three major mechanisms which are included: Baroreceptors, Chemoreceptors, Cns Ischemic Response. Now there are also three other different mechanisms which are included under rapidly or the short acting mechanism. They are low pressure receptors, bend bridge reflex, volume receptor. There are so many reflexes are there, but we will mainly see this bend bridge reflex. Then second category is intermediate acting mechanism. Means here you will find that here say there is one important mechanism is included: capillary fluid shift mechanism, stress relaxation of the blood vessels, and long-term acting mechanism. Now renin angiotensin system. Then second say mechanism which is included under this third category is there is long-term acting mechanism. Now remember that here say that once again I repeat that depending upon the time which is taken by these all regulatory mechanisms to regulate this blood pressure, they are categorized as rapidly or short acting mechanism. It acts mostly within say or controls the blood pressure within 20 minutes. Intermediate acting mechanism, it will take some longer time than this. Long term acting mechanism, it is a very longer mechanism, and that's why here they are categorized accordingly. So before going to start say our actual discussion, how say this say that is the blood pressure is regulated. As you know that say the blood pressure is regulated by, that is no doubt that is about say our say nervous system. And now there are some of the specific centers in our brain say which help here to regulate that is the blood pressure. Now they are previously used to be called as a cardiac centers. Now say these are called as the vasomotor center. Now vasomotor center is what is a portion of the medulla oblongata which together with the cardiovascular center and respiratory center regulates blood pressure and other homeostatic processes. Now this vasomotor center consists of three discrete zones or three regulatory centers. These are vasoconstrictor area, or say that is it is also commonly called as C1, vasodilator area A1, then cardio-inhibitory area. Now this cardio-inhibitory area is also called as medullary parasympathetic center or cardiac vagal center, is also called as nucleus ambiguous, which receives afferents from nucleus tractus solitarius, which sends inhibitory signal through vagus nerve to to decrease the heart rate and cardiac force of contraction. Just try to understand here vasoconstrictor area. Here say that is you will find mostly it helps here to increase the blood pressure. Vasodilator, which causes vasodilation and helps here to decrease the blood flow and decrease the blood pressure. And cardioinhibitory area is say nothing but which sends inhibitory signal through vagus nerve to decrease heart rate and cardiac force of contraction. Now where these all structures are situated? Now you can see, say that is the medulla. Okay, that is the what we call the medulla oblongata here. Vasomotor center consists of vasoconstrictor area. Now this vasoconstrictor area, where it is present, it is area called as C1, located bilaterally here in the anterolateral portion of the upper say medulla, consists of epinephrine, say that is secreting neurons. In short say it consists of your sympathetic nerve fibers. And exactly at the center say of this medulla you will find cardioinhibitory area located at the medial portion of vasomotor center. And extreme say at the lower say that is lever, you will find that there is other area what we call is the vasodilator area called as A1, located bilaterally in the anterolateral portion of lower half of the medulla. Okay, here and there is a one sensory area A2 which is not say that is shown here, located bilaterally in posterior lateral portion of the lower portion. We just try to understand here this first is the vasoconstrictor area, say that is located bilaterally in the anterolateral portion of the upper medulla and consists of epinephrine secreting neurons. Cardioinhibitory area located at a medial portion of the vasomotor center. A vasodilator area, say that is A1, located bilaterally in the anterolateral portion of the lower half of the medulla. And sensory area, which is not shown here, since the anterolateral portion is a sensory area A2 located bilaterally in posterior lateral portions of the medulla and that of the lower pons. Once again, just let us see briefly here what does say the vasomotor center consist. Vasomotor center consists of vasoconstrictor area, that is C1, which is mentioned here, located bilaterally in the anterolateral portions of the upper medulla, consists of epinephrine secreting neuron. Vasodilator area, say A1, located bilaterally in the anterolateral portion of lower half of the medulla, and fiber from this area project to the vasoconstrictor area to inhibit activity of vasoconstrictor area to cause vasodilation. These two areas are say interconnected. That is, say vasodilator area acts as an inhibitory say that is area to regulate the activity of the vasoconstrictor area. Now the sensory area A2 located bilaterally in the tractus solitarius in the posterior lateral portion of the medulla and lower pons, which receives signals from vagus and the glossopharyngeal nerve to control the activity of vasoconstrictor and that is the vasodilator area. Glossopharyngeal and that is vagus nerve. Then cardioinhibitory area located as shown in the medial portion of that is the vasomotor center. Now just under rapid say that is acting mechanism, the first part is the baroreceptors and the chemoreceptors. Now the baro means what? These are the pressure sensitive say there is structures what we call receptors and that is chemoreceptors which are sensitive to the change which is occurring composition of the blood. For example, mainly that of say hydrogen ion, that of partial pressure of carbon dioxide, partial pressure of oxygen. Now receptors are say that is they are called as say biological modulators, or these are the transducers. They change the response of the body. What is the function of these baroreceptors and chemoreceptors? Their major function is to sense the blood pressure and chemical composition of the blood for feedback to circulatory and the endocrine system. Now you can see baroreceptors and the chemoreceptors are present at the origin of the internal carotid artery. Now you can see this is common carotid artery. Okay, there are two bifurcation of this carotid artery. That one is the external carotid artery and third is the internal carotid artery. Then here you will find that that is a cavity like structure that we call a pouch or the carotid sinus, and say here you will find that is apart from that there are say chemoreceptors are present. That is at the bifurcation of the carotid body, they are called the chemoreceptors. Now these baroreceptors, where they are present? They are present in the two regions in the heart, that is the arc of aorta and the carotid sinus here, okay, which is not shown here. Similarly, they are also present in the some of the blood vessels according to their pressure, and hence they are categorized as low pressure receptors and the high pressure receptors. They are also present in the atria, they are also present in the ventricles. Okay, this is about the structure of the baroreceptor or where they are located. Now you can see here, what you can see in this figure, these are the aortic baroreceptors which are present on arc of aorta. They are present at the arc of aorta. Then here as it is shown in the figure, these are the receptors which are present at the bifurcation of the common carotid artery, the internal carotid artery, and that is what we call carotid sinus. How they are innervated? Now this aortic baroreceptor, these all baroreceptors are sensitive to the pressure change. They are not sensitive to the constant that is the blood pressure. They are rather more sensitive to the pulsatile nature or the changing nature of that is the blood pressure. Now how they are innervated? Now you will find that aortic baroreceptors, these aortic baroreceptors, what you will find is that they are innervated by that is the 10th nerve is cranial nerve, that is the vagus nerve, and the other nerve which is innervated, the other receptor which are present here at the carotid sinus, that is the carotid that is the baroreceptor, they are that is the innervated by Herring's nerve or sinus nerve along with that is the glossopharyngeal. Now you can see here in this figure, what does this figure indicate? It indicates that arc of aorta and the presence of baroreceptor, and it shows the innervation by the vagus nerve. Similarly, these baroreceptors which are present at the internal carotid artery at this pouch like structure or cavity like structure, what we call the carotid sinus or that is the carotid sinus baroreceptor. It is very clear. Majorly or mainly you will find that these baroreceptors are present on arc of aorta and that is the internal carotid artery at this cavity like structure or pouch like structure that we call as the carotid sinus baroreceptors. Then, now how they are classified? They are classified according to their function. They are also classified anatomically. Now they are functionally classified as high pressure baroreceptors and the low pressure baroreceptors. Here you can see in this figure, there is high pressure baroreceptor. Where they are present? They are present at the carotid sinus, they are present at the aortic arc, they are present at the wall of the left ventricle, they are present at the root of right subclavian artery and junction of thyroid artery with common carotid artery. There is another category of the baroreceptor which are not only sensitive to the higher pressure but also sensitive to the low pressure changes which are occurring in the blood, that is blood pressure. Now these are called as the atrial receptors. Mainly they are present in the atria and hence they are called as atrial receptors scattered in the wall of left atrium. Baroreceptors located in the right atrium at the entrance of the superior and the inferior vena cava, and in the left atrium at the entrance of pulmonary veins. When we are calling them atrial receptor, these are the low pressure receptors, since the blood pressure in the atria is less than ventricles and hence they are called as that is the atrial that is the receptors. The pulmonary receptors located in the wall of the pulmonary trunk and its division into right and left pulmonary artery, that we know. Then now there is the second category of this classification that we call it the anatomical classification. There are also the other baroreceptors which I told you, which are present in, that is say there is blood vessel, mainly say artery, then we call the arterial baroreceptors, which are located in the wall of the arteries. They are distributed mainly in the adventitial layer. Remember that when we are saying that these are present at the arc of aorta and the carotid sinus, I mean they are mainly present at the external layer of the blood vessel or adventitial layer of the blood vessel. There is the second group of say anatomical classification, what we call it as cardiac baroreceptors, which are located in the wall of the heart subendocardially as atrial receptors and ventricular receptors. Now say atrial stretch receptors, these are also called as atrial stretch receptor, which are scattered throughout the wall of atria and interatrial septum. I mean they are say sensitive to the pressure, say which is present in the atria, and the atrial walls are stretched, and hence they are called as the atrial stretch receptor. The pulmonary venoatrial receptor, which are located in the left atrium at the entrance of, that is, the pulmonary veins. The second category is the ventricular receptors, which are scattered throughout the left ventricle and interventricular septum. Now just see their location. Anatomically, these ventricular receptors are scattered throughout the left ventricle and interventricular septum. Now where they are located? For example, mainly say we will see carotid baroreceptors are located in the carotid sinus, which is a small dilation of the internal carotid artery just above the bifurcation of the common carotid artery into the external and internal carotid branches. That I have shown that figure. Aortic arc baroreceptors are located in the wall of arc of aorta. How they are innervated? The carotid sinus baroreceptors are innervated by carotid sinus nerve, which is also called as Herring's nerve. It's a branch of glossopharyngeal nerve. All other baroreceptors are supplied by the vagus nerve, and so those fibers which are originating from say this baroreceptor and conducting the impulses towards brain, I mean that is the say medulla, I mean these are what we call as the afferent say fibers or afferent nerve. They just relay their say that is impulses in the medulla at nucleus tractus solitarius. Now these are also called as vagus and the carotid nerve. They are also called as buffer nerves. Buffer means what? They try to compensate. They try to keep the balance between the variation in the blood pressure which is occurring in the body, or at this stage we will say in the heart. Now what are the peculiarities of the baroreceptors? If possible, if you are interested, you can write down as I am talking. The baroreceptor continuously monitor arterial blood pressure, and atrial stretch receptor monitor heart EDBV, means what? End diastolic blood volume. End diastolic blood volume. I mean that is the, say you may say the diastolic blood volume, I mean that is the volume of the blood which is remains in the say heart after diastole. That is called as the end diastolic blood volume. It says that baroreceptors continuously monitor arterial blood pressure, and atrial stretch receptors monitor heart, say that is the end diastolic blood volume. Second peculiarity is baroreceptor nerve endings, both free and encapsulated. These are in the present, as they are present in the form of say that the free nerve endings, or they are also encapsulated, are embedded in the outer layer, that is we call tunica adventitia, and adventitial layer of the arterial blood wall, which contains some elastic tissue. More than half of the baroreceptor axons are unmyelinated. These are C fibers. If you remember, while say studying that is the classification, there are say 7 types of the classification of nerve fibers. Then one of them is say that we have classified depending upon the myelination, that is the A type fibers, B type fibers and C type fibers. Sorry, A type of the fibers, they are myelinated, B type of the fiber, they are also myelinated, C fibers are unmyelinated. Now further, if you remember that this A type of the fibers, They are also divided into 4 categories: alpha, beta, delta and gamma. And then that is the B type of the fiber. Why they are categorized like that? According to their diameter, according to rate of impulse conduction, according to duration of their action potential and so on. But however, say more than half of the baroreceptor axons are unmyelinated. This is the third category of the nerve fiber classification, which are unmyelinated, which are C fibers. Now these are mainly involved in the conduction of the pain sensation. Now they show maximum response by number of impulses per mm of pressure change in the normal blood pressure. At the beginning I told you, say baroreceptor do not show that much response at that is a constant blood pressure, but however they show maximum response to the fluctuation of the blood pressure. They show response to the pulsatile nature of that is the blood pressure. And hence, the try to understand this meaning of the fourth category is that they show maximum response by number of impulses per mm of pressure change in the normal blood pressure. Means their response vary, their response change according to the change in the blood pressure. Okay, from moment to moment. Then fifth characteristic is the receptors show greater response to change in the blood pressure, mean that is pulsatile rather than to a constant pressure. Mean at a constant pressure you will not find say that much change in the baroreceptor activity. Receptors show slight greater response to the increasing pressure than decreasing pressure. I mean, they are more sensitive to the change which is occurring in the blood pressure or fluctuation which are occurring in the blood pressure. If a person has a persistently increasing blood pressure, the function of the baroreceptor is reset at a higher level. And this is the very important property of the baroreceptor. We call it the adaptability of the baroreceptor. Suppose that if any individual have any, say if you come across any patient, you will find that he is suffering persistently from higher blood pressure. Now, what is the normal role of the baroreceptor? Is to change, that is the pressure change, and then to bring down the blood pressure to normalcy. But however, in these situations, what happens? Say these baroreceptors, say instead of bringing this blood pressure down, say that is downward, what they do? They adapt themselves to the higher blood pressure level. Means they help here to maintain that level, higher level of the blood pressure, and hence that is the meaning of the seventh property, that if a person has a persistently increasing blood pressure, the function of the baroreceptor is to reset adaptation at a higher level. Eighth property. Baroreceptors exert their action for a very short time, means, and hence they are categorized under rapidly or short acting mechanism. Within say 20 minutes they are active. They do not take any part in the long term regulation of the blood pressure. Sensitivity of the baroreceptors can be changed by chronic disease. In some of the diseases where say that there is persistently occurring variation in the blood pressure, say sensitivity of the baroreceptor will change accordingly. The long-term say change or regulation in blood pressure due to loss of baroreceptor reflex control is called as neurogenic hypertension. Neurogenic means what? Here say the baroreceptor lose their say controlling ability due to the long-term change which is occurring in the blood pressure. And such type of say the hypertension which is developed due to loss of activity of the baroreceptor is called as, that is the neurogenic hypertension. It is called as neurogenic hypertension. I mean, these are some of the characteristics of baroreceptors. Now let us now say, that is study here what are the responses or what is the response of the carotid and say aortic baroreceptor to blood pressure, that is the to blood pressure. At normal blood pressure levels, receptors discharge at low rate and increase when the pressure in the carotid sinus and the aortic say arc rises and declines when pressure falls. What is the mode of action or how do say the baroreceptors respond? If at the beginning only I told you, say what is the action of the baroreceptor change in the blood pressure, or If the blood pressure remains constant, you will find that they will not fire, they will not be stimulated. But however, if there occur change, continuous change or a fluctuation in the blood pressure, there will occur more firing and more stimulation of the baroreceptor. That is the meaning of this first part or first point. At normal blood pressure levels, receptor discharge at a low rate. Means suppose that say that the blood pressure is low, then there will not occur any discharge from the baroreceptor. It increases when pressure in the carotid sinus and the aortic blood pressure say rises, and declines when the pressure falls. I mean, what does it mean? That baroreceptor will be only and only will be stimulated when there is an increase in the pressure in the carotid sinus and the aortic arc and rises. Aortic arc rises, means that the blood pressure rises, and declines when the pressure falls. Minimum pressure about 60 mm of mercury at which carotid baroreceptors are stimulated is called, it's the threshold of baroreceptor reflex. Now there is a range of say baroreceptors, they will be active. Generally it is said that 50 to 160 mm of mercury or 60 mm of mercury. Means what does it mean? When pressure about 60 mm or when the pressure falls from its normalcy to the 60 mm of mercury, at which carotid baroreceptors are stimulated, and it is called as threshold of stimulation of this baroreceptor reflex. Above threshold level, means suppose that now if it increases say more than 60 or 100 mm of mercury, baroreceptor responds to progressively more rapidly till the discharge rate reaches a plateau. No further increase in the response at above 150 to 160 mm of mercury. What do you mean by that? Here say persistently say blood pressure is say increasing. Similarly, what will the say action of the baroreceptor? Baroreceptor will also be stimulated. They will also say fire. They will also say that is stimulated progressively, more rapidly. This is first part, till the discharge rate reaches a plateau. Means there is a limit of the discharge. Say means although the pressure may vary, but when it reaches to say this much higher value, what will happen? There will not be further say stimulation of the baroreceptor. At this level, you will find that say they will remain say that is at the constant level of say that is activity. There will not be any firing, there will not be any stimulation of the baroreceptor. I mean what we say that now discharge rate reaches say at a plateau. Plateau means they reach at the constancy, and there is no further increase in the response is observed. Mean what does it mean? At above threshold level, baroreceptor respond progressively more rapidly till the discharge rate reaches a plateau, and no further increase in the response is observed. Plateau at say 150 to 160 mm of mercury. In normal say operating range of 95 to 100 mm of mercury, slight change in the pressure causes strong change in the baroreceptor reflex signal to readjust the arterial blood pressure to normal. Although we have said that this is the normal range of the baroreceptor, in the range of they function smoothly, that is the 50 to 160. But however, if you observe this say that is the pressure range of 95 to 100 mm, if there is a slight change in the pressure, it causes a strong change in the baroreceptor reflex signal to readjust the arterial blood pressure to normal. When on contrary, when blood pressure decreases below normal level, baroreceptor discharge decreases and reflexively bring the pressure to normal and the vice versa. What we have done? Now say normally say as it is said that here say that is the minimum pressure is 60 and maximum pressure is 160. Mean baroreceptor will function smoothly. There occurs variation in this temperature, they will say cause say certain changes, that we will see. But however, mean in short, when blood pressure decreases below normal level, baroreceptor discharge decreases. Mean they will not be stimulated more. And reflexively, now what happens at the say that is this lower pressure, and reflexively bring the pressure to normal and vice versa. What does it mean? What does it mean? When there is an increase in the blood pressure, baroreceptor will bring down the blood pressure. When there is a decrease in the blood pressure, they will act say the contralaterally. That is means you will find that the blood pressure will increase. And hence that is the meaning here. When blood pressure decreases below normal level, Baroreceptor discharge decreases and reflexively bring the pressure to normal, and that is the vice versa. Now this is a short summary what we are going to study. Normally baroreceptor discharge at a low rate, discharge at increase at high blood pressure and decrease at low blood pressure. Below 60 mm of mercury there is no discharge at all. Above 160 mm of mercury, no further rise in the discharge, where you will find plateau. Plateau is not observed at the lower pressure. That is, baroreceptors are sensitive in the range of 60 to 160 mm of mercury. This is the pressure range. Nowadays in some of the books they mention here say 50 and 160 mm of mercury. Doesn't matter. Maximally sensitive at mean arterial pressure of 95 mm of mercury. What is this mean arterial pressure? If you remember, this is the average pressure which is remaining in the, say, that is the blood vessel during a cardiac cycle, during one cardiac cycle. Now it should be in the range of 95 to 100 mm of mercury. Now say maximally it is sensitive to the, say, mean arterial pressure of, that is 95 mm of mercury. Then say maximally sensitive at mean arterial pressure 95 mm of mercury, respond more rapidly to changing blood pressure, that is what we meant to say pulsatile, to say that is nature of the blood pressure, than to a stationary high or low levels of the blood pressure. Low levels of blood pressure. Now just give a look to this lower down figure, here this figure, what you will find here. What you will find here. That is, so it shows here, say that is the pressure change starting from 80 to 120. Okay, this is the, say that is the my left side panel and this is the right side panel. In the left side panel you will find this is, it shows a normal range of a blood pressure, and you will find that firing rate in the afferent neuron arising from carotid and sinus baroreceptors. Now you will find that there is not that much fluctuation in their response, but however, if it increases, say in the more than this 80 to 120, you will find the firing rate changes. In short, say at the low pressure level they are stimulated less, and at the higher pressure level they are stimulated more. Mean here, say carotid sinus receptor baroreceptor responds to the pressure between 60 to 180 mm of mercury. Baroreceptor respond to the changes in the arterial pressure. Baroreceptor reflex is most sensitive at a pressure of, say, 95 to 100 mm of mercury. At pressure increase in the number of, say, that is the impulses from carotid sinus increases, which results in inhibition of vasoconstrictor and activation of vagal center. It shows here that is the role of baroreceptor, which is play due to increase in the blood pressure. Suppose that, if now let us assume that a hypothetical situation. Now our say blood pressure suddenly increases. Now say that is, you will say it increases, say, more than 120 mm of mercury. What will happen? What will happen? As you remember, there are, say, three areas: vasoconstrictor area, vasodilator area, vasoinhibitory area, and the fourth is a sensory area. Now when there is a, say, that is the increase in the, say, that is the that is the pressure, then there is a more firing of the baroreceptor, and this, say, baroreceptor from carotid sinus cause inhibition of the vasoconstrictor center. Vasoconstrictor center contains the sympathetic fiber, they will inhibit the activity of the vasoconstrictor center, so that it will cause, say, decrease in the blood pressure. By decreasing the heart rate, decreasing the cardiac output, then say that is causing the vasodilation of the blood vessel. Then second is the, say, now how it will bring down the increase in the blood pressure to the normalcy. Now there is, say, other area that we call it the, say, that is the cardioinhibitory area, that will cause here, say, activation of, that is the vagal center. Vagal center. And here, say, this vagal, what is the role of the vagal center? It causes the four major effects: decrease in the heart rate, decrease in the force of contraction of the heart, then decrease in the, say, rate of impulse conduction across the muscle fibers, and that is, it will cause decrease in the, say, excitability. It will cause, say, that is the all negative effects in the, say, functioning myocardium. Then, say, what is in short, what is the mechanism? In short, let us see here. Baroreceptors, say afferent fibers, enter the medulla, that is the what we call the tractus solitarius. Now the secondary signals inhibit the vasoconstrictor center of medulla and excite the vagal parasympathetic segment. Just try to understand the second step. When the blood pressure increases, what happens? There will not occur more stimulation of the baroreceptors, but however, they will send the inhibitory impulses to the vasoconstrictor center of the medulla, and it will excite, that is the vagal parasympathetic center, cardio inhibitory center. They will inhibit, say that is the cardio, say inhibitory area is there, and that will, what is there, its effect. Now effect of, say, the stimulation of, say, vagus nerve or parasympathetic nerve fiber, it causes vasodilation of the veins and arterioles. It causes decreased heart rate and the strength of heart contraction. These are these manifestations, these changes which are occurring after increase in the blood pressure will cause, say, or bring down the blood pressure to normalcy. In short, say, therefore, excitation of, say, that the baroreceptor by high pressure in the arteries reflexly causes arterial pressure to decrease and decrease in the peripheral resistance and the cardiac output and so on. And conversely, remember, the low pressure has the opposite effects, reflexly causing the pressure rise back to the normal. Suppose now let us assume that blood pressure has fallen to the is a lower level. Okay? Then what will happen? As usual, the first step remains same. Baroreceptor enter the medulla, and the secondary signals inhibit. Now, say the vasoconstrictor area, they will not cause a vasoconstrictor area, but they will inhibit vasodilator area, and they will stimulate here vasoconstrictor area, just to cause increase in the force of, say, contraction of the heart, increase in the, say, that is velocity of the impulse conduction, increase in the excitability of the heart, and then fourth is the force of contraction. These all effects will cause vasoconstriction of the veins and arteries, and say it will cause increase in the heart rate and strength of, say, contraction. Therefore, excitation of the baroreceptor by high, that is the low pressure in the arteries reflexly will cause arterial pressure to increase the, say, that is the blood pressure by, that is the increase in peripheral resistance and that of the cardiac output. Similarly, now the second mechanism which is, say, involved is what we call as the chemoreceptors. Now the word chemo means what? Say, these receptors are sensitive to composition of the blood, sensitive to the mainly to the three important factors: oxygen, carbon dioxide, and the hydrogen ion concentration. Now I will say, in other words, concentration means partial pressure of oxygen, partial pressure of carbon dioxide, and that is the pH. But decrease in the pH causes the acidity, and increase it causes the alkalinity, that all of us. Okay. Now you can see, say, there are two types of the, say, that is the chemoreceptors. You must have studied, I don't know so far how much you have studied about the respiration, but say these are the, say this is in the respiration, the chemoreceptors are present. They are mainly important in the regulation of respiratory rate and so on. Similarly, this chemoreceptor play a very important role in the regulation of blood pressure also, and hence depending upon their, say, location, they are, say, divided into two types. That is what we call as the peripheral chemoreceptor and chemoreceptor. That is the central chemoreceptor. Central chemoreceptor which are present in the, say, medulla, and peripheral is, that is the chemoreceptor, they are present mainly in carotid sinus. Present in, that is the, say, they are present at, that is the, say, what we call it as, that is the present at carotid sinus, bifurcation of this carotid artery. And now remember, just to differentiate from baroreceptor, they are named as, that is the bodies, carotid bodies and the aortic body. Now aortic bodies as shown in the figure, they are present at the arc of aorta, and this carotid body, they are present at, that is the, say, internal carotid artery, and that is the bifurcation. Now they are also innervated by the same nerves, that is by the sensory nerve, that is the vagus nerve, and that is by glossopharyngeal nerve, as it is shown here in the figure. Say, that is internal carotid artery, Now you will find these are the peg-like structure which are meant for, that is the what we call it as the that is the chemoreceptor or the aortic body. And here now say the aortic bodies which are present at, that is the carotid sinus, they are innervated by ninth nerve, that is glossopharyngeal nerve, and those which are present at the arc of aorta, they are innervated by, that is the cavity. Next is that these receptors are sensitive. These are the carotid bodies and the aortic body which sense the change in the partial pressure of carbon dioxide or partial pressure of oxygen and the pH of the blood. Remember, they have the ability to assess, to say recognize the change in the partial pressure of carbon dioxide and that of oxygen, and the change in the concentration of hydrogen ions or pH. They are connected to the respiratory centers, 9th carotid bodies, and 10th, that is the aortic, 10th nerve in the cranial nerve to the, that is the aortic body. When there is an increased partial pressure of carbon dioxide, decreased partial pressure of oxygen, or decreased, say, that is pH, they are stimulated and led to the stimulation of respiration. This is the one important, say, that is the hypothesis here, that now the central chemoreceptor, they are sensitive to change in the partial pressure of, say, that is carbon dioxide and that concentration of the hydrogen ion. Now what happens to that we know. But however, here remember that in the peripheral, say, that is chemoreceptor, they are more sensitive to the change in the partial pressure of oxygen. If there occurs a decrease in the partial pressure of oxygen, say these baroreceptors are sensitive to the oxygen, say, that is the concentration, and these are called as that is the special type of, that is the chemoreceptors. When there is an increased partial pressure of carbon dioxide, what we call hypercapnia, means increased concentration of carbon dioxide, decreased, say, that is the concentration of partial pressure of oxygen, or decreased pH, they are stimulated and lead to the stimulation of respiration. Same time, remember that. Now, say, this chemoreceptor function in a dual manner. They also help here to regulate respiration. Some part is also played in the cardiovascular system. Okay. Now remember, especially these peripheral chemoreceptors are more sensitive to the, say, oxygen concentration. If the lower is the oxygen concentration, more will be their stimulation. Hence a decreased PO2, or that is the hypoxemia, that what we call it. It is as it is shown that location of baroreceptors and the chemoreceptors. Now just concentrate on these, say, two types of the structure. That is the, say, it is knob-like structure, hence it is called as the, there is a carotid, say, that is the this is carotid, say, that is the chemoreceptor, and or chemoreceptor, or what we call it as a carotid body, and those which are present here at the arc of aorta, which are called as, that is the aortic body. Then carotid bodies are located on the external carotid arteries near the bifurcation with the internal carotids. Each carotid body is few millimeters, say, in size, that is about 1 to 2 mm in the size, and has the distinction of having the highest blood flow per tissue weight of any organ in the body. Means it is having the highest, say, there is a blood flow as compared to the, say, that is a per tissue weight of any organ in the body. Means this blood flow is at 2 liters per minute per 100 grams of the tissue. Means this is the highest rate. The aortic body is located in the region of the aortic arc, and the roots of the major arteries in the thorax are innervated by the efferent and afferent fiber coursing in the aortic nerve branch of the vagus, and these organs are also supplied with the sympathetic efferent fiber. What does it mean? The aortic bodies are located in the region of the aortic arc, okay, and the roots of the major arteries in the thorax. Okay. Now there is a second category of the, say, that is the chemoreceptor, what we call as the central chemoreceptors. These are the cells, neurons, which lie just beneath the ventral surface of the medulla oblongata, and therefore called as the medullary receptors. Hence they are called as the central chemoreceptors. Neurons of the central chemoreceptor project directly over the respiratory center, which are slightly deeper to the central chemoreceptor. Remember, at the beginning only I told you, the major role of say that chemoreceptor is the regulation of the blood pressure. But however, they also play very important role in the regulation of blood pressure, assessing the change in the oxygen, change in the carbon dioxide, change in the hydrogen ion concentration. Apart from that, you will find there are also present, say, this chemoreceptor in the pulmonary and myocardium, and hence they are called as the pulmonary and the myocardial, that is the chemoreceptors. Now coming to the carotid body. Now the carotid body is a chemoreceptor located in the adventitia of the bifurcation of the common carotid artery. It is also present in adventitial layer. Remember, chemoreceptor function. How do they function? Carotid body monitors the blood's pH, partial pressure of carbon dioxide and partial pressure of oxygen. We know that the partial pressure of carbon dioxide is approximately, say that is how much it is, 40 mm of mercury, and that of the oxygen is 100 mm of mercury, and thereby modulates cardiovascular and the respiratory function primarily through the sympathetic tone. When the carotid body senses acidemia, hypercapnia or hypoxia, autonomic firing leads to increased blood pressure, heart rate and thus respiratory rate. Just remember that if these changes are occurring, either increase in the partial pressure of carbon dioxide and decrease in the partial pressure of, say, that is oxygen, there occurs autonomic firing. Firing means what? Stimulation of the sympathetic fiber, which cause here increase in the blood pressure, heart rate and respiratory rate. The function of the carotid is complemented by other chemoreceptors, most notably the aortic body located in the aortic arc. Means here here up to certain extent you can see carotid body along with the, say, that is the aortic body, say, they here help to maintain, that is the normal respiratory rate as well as, that is the, say, blood pressure. Then now, as we have seen, say, just to summarize here, they are located in the bifurcation of the common carotid artery. Their average size of the carotid body is 3 to 5 mm in diameter and average weight is about 12 milligrams. Blood supply from external carotid through Meyer's ligament, that is, provides attachment to the carotid, that is, and innervation, that is how they are innervated. Herring's nerve, also called as the Carotid Sinus nerve, a branch of glossopharyngeal nerve originating from 1 centimeter distal to the jugular foramen. Now there are one important thing. Now that figure you must have seen while studying the respiration. Now they are composed of the two receptor cells. Means they are surrounded by two types of the receptors, that is what we call type 1 and type 2 cells. These type 1 cells are called as the chief cells, and the type 2 cells, they are not that much active as compared to the chief cell, but these are the glial cells, these are the supporting cells, these are called as sustentacular cell, and the type 1, they are called as the chief cells. Now these are derived from the neural crest, and what is their function? On stimulation, they release acetylcholine, ATP, dopamine, noradrenaline, substance P, then metencaphalin in response to activation. And the other type 2, they act here as the sustentacular cells, or that is the supporting cells. What is the action of the chemoreceptors? Now let us see here about the peripheral chemoreceptors. The receptors in the carotid sinus and the aortic are sense the change in the partial pressure of oxygen, partial pressure of carbon dioxide and pH. If, say, there is a decrease in the partial pressure of oxygen or increase in the partial pressure of carbon dioxide, if there is a decrease in the, say, that is the pH, say, peripheral chemoreceptors will be stimulated. But remember here, at what, say, blood pressure, this, say, peripheral chemoreceptor will be stimulated? When the blood pressure falls below 60 mm of mercury. Okay, and then only you will find that, you will only find that the partial pressure of oxygen decreases. Now say, that is the carotid, say, body, also called as chemoreceptor and carotid sinus, transmit, say the impulses to the brain stem via carotid sinus now. Carotid sinus now joins glossopharyngeal now, that is ninth now, and that synapse in the nucleus tractus solitarius of the medulla. You may say that some of the fibers are also given to the respiratory center and as well as that is the cardiovascular center. Then coming to the aortic bodies, they are also called as chemoreceptors in the aortic arc that transmit to the brain stem via vagus nerve or the 10th cranial nerve. Say this 10th cranial nerve synapses in the nucleus tractus solitarius of the medulla, same thing. Now the central chemoreceptors in the medulla cells either change or decrease, say increase or either say that it decrease the partial pressure of carbon dioxide. Similarly, either decrease or increase in the pH, okay, and that is not say that is they do not say sense here the change in the either decrease or increase in the partial pressure of say oxygen in brain fluid. The central chemoreceptors are not stimulated by hypoxia, remember that. Like others say, they are depressed by hypoxia. Partial pressure of carbon dioxide and that of the pH is influenced by arterial say carbon dioxide. Now you have studied here that say that is how this carbon dioxide is say transported across that is the blood brain barrier. Now regarding the peripheral chemoreceptors, these chemoreceptors are sensitive to changes occurring in the chemical composition of blood and they show response to chemical composition of oxygen, mean that is mainly partial of carbon dioxide and that of oxygen and change in the pH. They are structurally and functionally different from baroreceptors. Remember, this is one important thing. The major function of chemoreceptor is to regulate respiration. They also help to regulate say blood pressure. Whenever there is a decrease in the partial pressure of oxygen or increase in the partial pressure of carbon dioxide or decrease in the pH, that is the increase in the hydrogen concentration, in this situation say chemoreceptors will be say that will be stimulated. On stimulation of this receptor, what happens? Afferent fibers from carotid body transmit impulses to the ninth nerve to the medulla oblongata, and ninth nerve and afferent fibers from the aortic body also transmit impulses to the 10th nerve. These impulses reach medulla and from which stimulatory impulses are sent to the cardiostimulatory center and inhibitory impulses are sent to the vagal center. Hence, there is increase in the heart rate, force of contraction and in cardiac output and generalized vasoconstriction, and all factors help to increase the blood pressure. Same time there is a hyperventilation that will also help here to maintain partial pressure of oxygen and the carbon dioxide normally. Chemoreceptors are stimulated when blood pressure falls below 60 mm of mercury, because why? At this pressure there is relative hypoxia. Hypoxia means lack of oxygen, hunger for oxygen of chemoreceptor, and they will prevent further fall in blood pressure. With 60 mm pressure is very important. If they are fall below 60 mm pressure, the chemoreceptors will be stimulated. Now under this, say the second, there are also the other mechanisms which are included in, that is say rapidly acting mechanism, what we call it as the Cns Ischemic Response. Then second is the capillary fluid shift mechanism. That I will say, we will see this part in the next lecture, and I will stop here. Thank you for patient say that listening. Okay, and be healthy.